news site. So today on this 26th of July, Monday, and a summer day, we have with us a guest, Sonny Rama, Vice President of Development and Innovation with the VNA Healthcare. And Sonny's going to be looking at the vaccination front here. So stay tuned with us here and listen up as we learn more about vaccinations from Sonny Rama here. So Sonny, we're going to bring him up right now. Hello, Sonny.
John, always a pleasure to connect with you. How are you?
I'm doing pretty good. Tell you, this heat sometimes gets me a little worn down, though, I'll be honest with you. And then I have the opposite effect. My house gets too cool, and I feel that's not good. So it goes back and forth between too hot and too cool.
Wow.
But we'll just give Sonny a good welcome here. And we welcome Sonny today with us. And Sonny's just going to be touching on the vaccination front and other things that VNA is doing right now. And Sonny heads up those type of things. So, Sonny, just give us your perspective on the vaccination front here in Kane County and what VNA is doing.
Great. Well, thanks, John. We continue to vaccinate at our health centers, as well as host and manage some of the off-site clinics throughout the area, at churches, employer groups, senior living facilities, as well as do homebound vaccination. So right before July 4th holiday, we vaccinated our 50,000th associate individual in the markets we serve. So it's a really big accomplishment for us. Very proud of the fact that we've vaccinated so many people really over 6 months. So our goal this year is to vaccinate, again, continue our vaccination goals and continue to vaccinate those in our community. We have seen the number of attendees at our health center, patients in our health center, as well as our clinics, the number go down. But surprisingly, there are still a fair percentage of folks in our communities that have not gotten vaccinated, haven't gotten their first dose yet. So we continue to promote the fact that it's really critical, especially with all these variants going on, that's still kind of the unknown, to get vaccinated, get that first dose vaccination completed. And then for those folks that really can't, attend a health center or a, vaccination clinic event, please call us, and then we'll bring our team to your home to provide the homebound vaccinations. So we are working, thanks to John and other leaders in our community. We're doing more events at local churches, other now back to school events, as people and kids are preparing to go back to school here in the coming months. And it's really critical for us to get as many folks as possible vaccinated, because then what's going to happen in a couple of months, starting in September, mid-September, the focus would be on getting now a critical flu vaccination shot. So it's really important now, more so than in years past, to get that flu vaccination in place, coupled with the COVID vaccination. So again, we're continuing to fight the fight and promote the need to get vaccinated. But again, there's still a lot of folks that haven't received that first dose, and we'll make sure that they know that the VNA is here to support them, whether it be at one of our health centers, at an outside clinic, or in their home.
Yeah, the numbers been going down at the bottom of the screen there. The call to VNA to get your vaccination updates and get in line there, or just call them. And about that homebound, there were beacon about a couple of months ago now. Yep. I guess we had a nice article about your work with homebound individuals, and that's a very interesting thing. So if people out there know of someone that can't get out, or various limitations why they're not going out, the VNA will step in and get that vaccination, because we got to worry about people. Even if they're not getting out, somebody coming in might give them, it works both ways. And it's better to have, if you can get that homebound person vaccinated, that'd be the best. Sometimes we just have all the healthcare workers around some homebound people, make sure they're vaccinated, but it's better to if you can get that homebound person vaccinated. Yeah.
Yeah, absolutely. What we found is there are many folks, John, to your point, that are homebound, right? They cannot go to one of our health centers. They cannot go to a max vaccination clinic. They can't go to a CVS or Walgreens or a Walmart. And they were on lists early on, multiple lists, multiple waiting lists, and then somehow, some way they got lost in the shuffle. So they may have been on the waiting list of, 5, 10, 15 different locations, but they got missed. So what we're doing, and there's no charge, any of the vaccines we're providing, there's no charge to our patients or anyone in the community. I just want to make sure everyone's vaccinated. We'll schedule an appointment. One of our nurses or nurse practitioners will go into the home, and we can vaccinate that individual, that homebound vaccination, their spouse, their loved ones, and their caregivers. And they do not have to be a VNA patient. I mean, we're doing this for anyone in our community, VNA patient or not. So to your point, there's still a fair percentage of folks not vaccinated, but we still see a steady demand of those folks that are at homebound that need help, because there aren't many groups like the VNA that are providing the vaccine in the home. Maybe initially early on, but not now. So again, please reach out to us. Let us know how we can help, and we'll be provide that vaccination in your own home, in your own home setting. Make it as easy as possible, as convenient as possible. We'll take care of you as well as your family members in the home, as well as your caregiver. So again, reach out and let us know how we can help.
Well, that's a real nice thing you're doing there, to reach out in the community. And I know sometimes there's some groups that would go out and through Medicare, and that would go to homes on homebound, but you're doing that for it doesn't have to be under Medicare, to just anybody who needs that homebound service. It's really beautiful. That number, it's at the bottom of the screen. You're still doing testing too, right?
We're doing testing. We're doing the vaccinations. And as to your point, whether you are a Medicare recipient or Medicaid, or you have a commercial plan, because we're not billing insurance, and because regardless if you're a VNA patient or not, it doesn't really matter to us, right? So, we're doing the testing, and we're also gearing up again in a month or two. We'll be gearing up for these flu vaccinations,
right,
as well. Most likely we'll start once we have an inventory of vaccine for the flu in early to mid-September. But we are seeing, John, a lot of folks reaching out to the VNA to make sure their children are vaccinated, because again, they're going back to school here in many cases in the mid-August or so, right? So we're invited to a lot of these back to school events to participate, vaccinate as appropriate, hand out some VNA tchotchkes, but also just provide some education to those folks that have many questions on, not only vaccinations, but, primary care, back to school physicals, and immunizations as well.
Yeah, that's very good that you're doing those things. I was just thinking that out there right now on the vaccination front, those who have been hospitalized and have come down with COVID, basically 99.5, or there's different, it's up there, 97 to 100% almost, have all been unvaccinated.
Correct.
And so that is, and I'm sure that's here in King County, and I haven't heard different in the state that way. So I think we're on that front. We're not as bad as some other counties. I know we're at like 5 cases per 100,000. I looked this up the other day. It's a New York Times website. It's got a lot of information on these things like that. And my cousin out in California, in Orange, it's 15 per 100,000. And then we go down to Tallahassee, the state capital of Florida. It's 41 per 100,000 cases. So
wow,
the COVID's really going on in Missouri. I have a relative there. I think it was 30 at Odessa area where my cousin lives out there, and Memphis was almost 20. So we're very fortunate that it's down here, but that variant sneaks around here and we're not vaccinated. That's not good, right, Sonny?
Yeah, I think this is obviously a lot of is unknown, right? We follow the guidelines from the CDC. We have these variants that are out there, California, right, Florida, some of these large states. It's starting to get out of control again. So it's why I cannot say enough about how it's important to get vaccinated, at least get that first dose. I know a lot of folks have some apprehensions and concerns, and understood, but the vaccines have really been proven to combat the COVID, right? So we just need to make sure that everyone in our community is vaccinated. We cannot stress that enough. And the numbers are pretty telling. 90% of those that are dealing with these variants, hospitalized, etc., are not vaccinated. And there are some reports, but small percentage of folks that did get vaccinated that are also tested positive, but they're not as vulnerable, right? They're not in a high risk category compared to those that have not been vaccinated. So again, please reach out to us, reach out to your provider, get some more information, because I think also, John, there's a lot of misinformation out there about the various vaccines and should I get it or not. But I think now, at least in the markets that we serve, the need is also not to get children vaccinated as they return to school. Some cases it's mandated that they get vaccinated, the staff, the teachers, etc. So again, please follow us and reach out to us and let us know how we can help. We'll definitely send you or share with you the right information so then you can make a well-informed decision on how to pursue getting vaccinated.
Yeah, and we're hopefully in the next month or so, the Pfizer will be, quote, be authorized. In other words, it's checked all the way out instead of just being an emergency.
Yeah.
And that might change some of our thinking on mandates too. And I know the Roar Beacon had a front page story today about the Paramount, and they're going to mandate their people at their shows be vaccinated.
Okay, good.
I mean, and then the other story is sometimes we say, well, you make your choice being, in masking, and that's a tricky one. But my personal point is that I think it's best everybody wear a mask, even if you're vaccinated. So I don't want to put all the shame or whatever you want to say on those who aren't vaccinated and say they got to wear masks. I think it's best everybody wear a mask. I don't think otherwise. I've noticed that I know people aren't vaccinated and they're not wearing masks. So
absolutely,
this is a problem, and it's gonna. I don't like to get into that part, but we got to work on this. It's a long haul thing, and we got to persuade people. It's the Chicago Tribune, my friend, just showed me an editorial about how they were saying, well, let's get vaccinated, even though they almost wanted to mandate it. They didn't want to do that though, but we got to be thinking about that for all our friends and our groups. Now I think I've done a little. We're hopefully doing more. Churches, and I know businesses can get a vaccination in those centers, and that does help, even though sometimes they can be small. We don't want them to be small, but they just happen to be that way. And I know I was seeing on CNN about a barber shop, I think it was in Arkansas, and maybe they got 15, but that was 15 that weren't before, and they just couldn't. The barber guy couldn't see that because he had COVID, and he just said he had to do this, for his friends. And I know we got businesses that can do this, and churches and other groups that can reach out, right, Sonny?
Yeah, we're trying to make this, John, to your point, as convenient as possible. Actually, we're doing a grocery store clinic tomorrow. The owner of the grocery store wants his employees vaccinated and wants folks coming into their grocery store to have the option of getting vaccinated. So exactly, we're trying to make it as convenient as possible. We have organizations where they have allowed us to set up a clinic outside their offices. We have a mobile van where we can utilize that mobile van and then set up some tents and tables and chairs and do it right outside the organization's, the actual organization in their parking lot. So to your point, churches, we've been working with a lot of local pastors here in Kane County and DuPage. Many of the pastors have been vaccinated, but they're concerned about their congregation. So they're mentioning in Mass, during Sunday Mass, please reach out and connect with the VNA. And we've been very fortunate to connect with some churches in the community and set up clinics Sundays after Mass or during the middle of the week. Again, just to make it as convenient as possible, but just as important, just help inform the folks in our community what is available to them to make it very easy, very simplistic. So we are working with a lot of leaders like yourself to get the information out there, churches, organizations. Again, a grocery store. Who would have thought that we would have a clinic at a grocery store? But you know what? High traffic. The owner of the grocery store also wants their employees to get vaccinated. So we're going to be there. And it may be a small number that get vaccinated, to your point earlier, John, but if it's 5 or 10 or 15, that's 5 or 10 or 15 more people that weren't vaccinated before VNA was on site.
That's correct. And I know there's the Aurora City government has been involved in, I think it's on my website. I know VNA put it out, and the city of Aurora last Friday, there's a news release on, I think, 4 sites in the next week here having vaccinations. And I know one that I have some relationship with, Family Focus, I think is on Wednesday. Their one is on Wednesday.
Mm-hmm.
So there's look at the website, look at my website, xpin.news, or go to the VNA website there, and you can find out more about some of those ongoing vaccinations that are right now happening. And we need more. And Sonny has been involved with this, and we appreciate Sonny coming by and visiting here. And keep me informed, Sonny, on what's happening. And we just got to keep going at this. This is these variants we're fortunate, like I said, that we haven't been hit as hard in our area yet, but we don't know. That's the point. We don't know when this is, how this works. This virus doesn't tell us all the time what it's doing.
Well, John, I want to thank you first of all for again having me back on your Facebook Live show, your event. Because of your advocacy and support for VNA, you've been able to connect us with some other leaders in the community where they have set up a clinic with, utilizing VNA and our staff. Again, we bring everything to that location. So appreciate your support. You're really helping us do a lot more good in the community and reaching out to a lot of folks that perhaps we were not able to connect with because they didn't know was available to them. So thank you very much, John, for all the support that you provide to VNA Healthcare. We appreciate it.
Well, thank you, Sonny, for coming by here, being with us today. And
thank you.
We wish the best to the VNA and their staff, and just that we just keep moving ahead here and fighting this virus. And remember, the flu shots are coming up too here. And I'm just going to put up one little thing here, and then we'll wrap it up. Just see you on Wednesday at 5. Lord willing, we'll have a guest here. I'm working on that, but and Friday we're going to talk with Scott Thurman with the township on youth. That definitely we have on Friday. So again, thanks, Sonny, for being with us here. And look at the bottom of the screen. We got the numbers there for you to call, the VNAhealth.com/COVID to get involved there. And if you know of a group or business that needs that would you like to have vaccination clinic, just call that number and let them know about that, and individuals too, to call them. And remember about that homebound thing. That's a very exciting, it's a good thing that the VNA does with homebound. So again, Sonny, thank you. God bless your work there, guy. And we'll see you next time, everybody. So God bless out there, and bye-bye now. Bye-bye.
Be well. Take care, everyone. God bless. Take care. Thank you.
Bye-bye.
Bye, John.
Bye-bye.